Non-pharmaceutical interventions remain vital in fighting COVID-19. That's the message from KwaZulu-Natal Health MEC Nomagugu Simelane as she pushes for more vaccinations in the province. She's concerned about the rise in infections, especially as it's the festive season and an influx of holidaymakers expected. KwaZulu-Natal has now overtaken Gauteng with daily infections. eNCA's Mawande Kheswa is in and around Durban and will bring us this latest update now. Mawande, good afternoon. Thank you very much for your time. What can you tell us this hour about the COVID trends in KZN?
Good afternoon, Braden. Well, the MEC for Health in the province, Nomagugu Simelane, held a media briefing, a virtual media briefing earlier on to give us some of the trends, some of which are concerning. One of those is that she says, according to scientific data that has been collected, they've seen that the younger population seems to be the ones facing the brunt of the Omicron variant, where they are getting severely ill. So they're facing that situation where it's the younger population really that seems to be getting severely ill, and this is a cause of concern for them as a department. Let's hear what she further had to say.
During this 7-day period under review, we have sadly lost 42 people due to COVID-19. While this is thankfully a lot lower than what we saw during this, the same or corresponding period last year, 42 lives is still 42 lives too many, as this number includes breadwinners, mothers, fathers, sons, and daughters, and a number of people who we all love. These 42 deaths have brought to 14,868 the number of people who we have lost due to this pandemic. And may their souls rest in peace. Ladies and gentlemen, these numbers are a grim reminder that COVID-19 is still here and it still kills.
Yeah, as you say, Mawande, very concerning trends, they're playing themselves out. Was there any particular message that the Provincial Health Department expressed to the people of the province and those who are visiting it during this festive season?
The message was quite simple, and it's that it's up to you to be responsible and carry yourself in a manner which protects not only yourselves but those around you. But the MEC also did concede that in settings such as restaurant, it is quite difficult for people to adhere to regulations as far as the seating arrangement is concerned. If a family is sitting at a table and they're enjoying their meal, it is quite difficult to not have on your mask, to have that social distancing. So in those kinds of settings, it does prove to be quite tricky. And that is something that's sort of a gray area. But in essence, she was saying that we are expecting holidaymakers to be in the province, and those who work outside of the province will return. And there was an expectation that numbers will increase. However, we are in a position where some people are fully vaccinated while others will be vaccinating. So it is up to them to ensure that they act in a manner which is or shows rather responsibility. Let's take a listen.
So instead of growing, our vaccination numbers have actually dropped in the recent weeks, particularly when we started to get into the festive season. We've moved from around 20,000 vaccinations per week to less than 10,000 infections. So far, our province has vaccinated 2.7 million people, while we still have a further and a staggering 4.4 million people to vaccinate still. The age groups of 12 to 17 years and 18 years to 34 of age are where we've registered the lowest rates of vaccination at 2.9% and 23% respectively. And yet these are the groups that make up quite a big proportion of our target population. We have started establishing vaccination pop-up sites in different areas, vaccination drive-throughs and sites, drive-throughs and so forth. We have started with pop-up sites, and we are implementing them in a number of towns, streets, and areas that are populated or are overly populated. We have even established pop-up sites in the beach so that people, while they come and enjoy themselves, they can also get an opportunity to get vaccinated, and we are bringing the vaccine closer to the people.